So let's talk about some unpopular opinions. What's your first one, Deanna?
Unpopular opinions. Um, it's hot. I don't want to wear a lab jacket. It's summertime and it doesn't matter. I'm just not going to wear my PPE like I'm supposed to. You have to.
Hmm.
That's a federal rule. That's federally sound rule. Bloodborne pathogens. You must cover your clothing from exposures.
Yeah. And I get it. I'm hot all day too.
I'm hot all day too, but find a way to make it work.
Yeah.
Find a way to make it work. Is OSHA going to come in and shut down your practice? No, but they can slap you with a fine. They
Yeah.
can slap you with a fine, and it's not going to look pretty. Make sure your staff wears their PPE too, but set the example. If you're the business owner, set the example.
Oh yeah. Yeah.
What's what's one of your unpopular opinions?
Training is not enough. Training is actually part of a larger compliance program, whether it's HIPAA, OSHA, HR, labor law, what documentation, whatever your regulations and safety programs are.
Mhm.
You can do part of it by doing training, but training is really so everyone is on the same page for the entirety of the program.
Yes.
And above and beyond that, everybody needs to attend. So, second unpopular opinion on that tangent, doctors
Mhm.
need to come to the trainings.
Yes, you're part of the team.
Yeah,
Yes.
you run the team, you are
You
the
run the
head.
team. Yes. Yes. And it clearly states with OSHA standards that employers are in charge of this. Employers must make sure employees are doing this and that. And if you're not a part of the training, you're not a part of the team.
Mhm.
And how are you setting the standard for your practice? And going back to policies, it's okay. You can buy a generalized infection control policy, but it has to be tailored to your practice. Not every office treats patients the same way in the same manner. Not every office has the same equipment. So you've got to tailor those policies to your practice, and then your team has to be trained on your office's policies. So, yes, training is not just enough. You can
Especially new
go
people.
especially new people. You can go to OSHA training, infection control training, HIPAA training, but how is it in your office? Your office team has to be trained on your office's policies.
Yeah. That way,
Unpopular opinion.
I mean, not in our office. Our office is a very
No.
popular opinion.
Right, right.
But in the dental industry, it's absolutely an unpopular. Everyone just wants quick, easy, and cheap, and unfortunately, those don't align with what the rules are.
That's right.
Nor does it actually help with safety.
Hmm.
And that's ultimately what all of these for. I think people tend to forget that when they're just trying to check a box. This is to keep people in the practice safe and to keep patients safe.
That's right. I mean, the ultimate goal is to really, we want to provide the most outstanding care for our patients, right? I mean, that's why we're here in dentistry. We want to provide them with a great treatment plan that's going to get them back to good health, but we have to do that in an environment that's conducive with safety. And so the staff, the team members have to have a safe working environment. They have to have the tools and the tricks and the policies in order to provide that care, that much needed care to your patients.
Yeah, I
Yeah,
agree.
yeah.
Well, unpopular opinion, it's not the multi-million dollar fines or federal or state violations
Mhm.
that are going to get you.
Mhm.
It's patient lawsuits.
Oh,
It's
yes.
there are never I've done so many of these data breaches and I've never had patients well, I've never had patients sue because I'm good at what I do, but I have I've never seen multi-million dollar fines, not in dentistry.
Yeah.
It's patient lawsuits. It's class action lawsuits, it's all the remediation, it's the stress, it's the chaos, it's the public relations nightmare. And
Mhm.
that's what truly costs in any kind of incident. So saying, or going to classes where they say this person got this $1.2 million fine and this organization, those aren't your organizations.
Right,
They're not your kind of practice. Um,
right.
they're not your kind of industry. So you need to make sure that you understand what's you and what's
Hmm.
for you.
That's right. That's right. And along with patient complaints, the state board can come into your practice anytime. If
Yeah.
there's a complaint by a patient and they see something that is unclean, out of whack, out of standard of care, they can contact the state board. And there are rules and regulations as a licensee that you must follow according to your state board. And the state board is going to look at OSHA and the CDC for these policy guidelines. And furthermore, if your office is not kept in a sanitary condition, if someone is practicing outside the scope of practice, if you have employees that are not trained, unlicensed professionals working in areas where they shouldn't be working, this can lead to a loss of licensure. We're not only talking about fines, but you could lose your license to practice in your state. Your office could suffer poor reputation. Patients and possible incoming patients may not want to come visit your practice. You may not want to have staff come work at your practice. So there's a lot of ramifications.
Yeah. Unpopular opinion, just because a patient lays out all the reasons why they think you suck on social media, on reviews, it doesn't mean you have the ability to respond in kind. You have to limit what you say and or better yet, just don't respond and outshine it with good reviews. I
There
know
you go.
innately as humans, we want to defend ourselves. We can't. We shouldn't. It's not that we
Yes,
can't. Physically, you can. You shouldn't.
you shouldn't.
Yeah,
Yeah,
very unpopular opinion. And I understand that deep-seated need to be like, no, you sucked. I don't suck. You suck. And we
right,
can't. We can't.
right. It's so unfortunate that a lot of times these reviews are one-sided and you can't share the experience that you had from the patient. But yeah, that's a tough one because you're right. We do want to defend ourselves. We do want to defend ourselves. Um, yeah, wow, wow.
What other ones you got?
I'm trying to think. Um, Unpopular opinion. We don't have time to do that. We,
Oof.
we just don't have time. We don't have time to document when we run a load in the sterilizer. We don't have time to suction our lines at the end of the day because we want to go home. We don't have time to shock our dental unit water lines. We don't have enough staff. We don't have enough time. Well, you'll probably have plenty of time whenever your office doors close because you weren't compliant in some areas. So
But true.
it's about creating those policies that your staff can adhere to, learning how to create that time to provide a safe environment for the staff members and for the patients that come into your practice. It's ethical decision making is what it is.
Love that.
Yeah. Yeah.
Yeah. So, unpopular opinion, cyber insurance is not your excuse to do dumb preventable things.
Ooh.
It's like
Ooh.
auto insurance. If you're naughty and you get a bunch of tickets or you get a DUI or OWI, depending on where you're at, what it's called, you
Mhm.
have to get bad driver insurance. Or if you get too many speeding tickets, you have to get bad
Mhm.
driver insurance.
Yeah.
because it's not a excuse for you to do naughty things.
Yeah. That people use it as a safety net?
Yeah, so it's changed quite a bit in the last few years, and now the insurance carriers are very discerning about
Mm.
being able to acquire it. So you have to have certain minimum standards in place, which sometimes dental offices still don't have.
Oh,
And
unfortunate.
I know. Well, sometimes their IT providers aren't helping them, or they think because they're on a cloud practice management system, that's all they have to do.
Wow.
And so there's a lot of other things that come into play.
Hmm.
So, um, yeah, it's kind of interesting. It's not your get out of jail free card.
Hmm. I have an unpopular opinion.
Okay.
Hmm. Not wearing puncture resistant utility gloves when handling contaminated sharps. Anything can happen.
Yeah,
We do work in a very fast-paced environment. So, putting on those utility gloves that are going to protect your hands and your fingers from sharps that could expose you to lifelong chronic diseases, it's important. It's
absolutely.
important. That is your life. That is your health. It's 5 seconds to put on those gloves. And there's so many different kinds out there. You can find some that fit, you can find some that are disposable. Wear them. Wear them. Protect yourself. Take yourself to heart. Take your own health to heart.
Yeah,
And if you do have an accident, no accident is too small to report. Let somebody know.
absolutely.
You are offered a healthcare opinion. You're offered assistance if you have an exposure. So use that.
Yeah. I mean, accidents do happen. I
Accidents happen, of course.
I've broken two dishes in my sink just this week because I just had the dropsies. I couldn't hold on to it, and I
Oh,
broke two of my
no.
bowls
Oh,
on different
no.
occasions, but
Oh,
I had gloves on. I had kitchen gloves on,
good.
and thank goodness I did because there were tiny little shards all over.
Thank goodness. Yes. Yes,
Yeah.
absolutely. That is a good one.
So, unpopular opinion, if your office gets ransomware, you have to stop what you're doing. There's actually a procedure for this, and most of the time I get called after decisions have been made and IT has already come in and wiped everything on the computer, or they've rebooted the computer and it has deleted all useful forensic information to know
Oh,
what happened and how and when. And that's technically a crime scene. And if you have cyber insurance, they may not pay if you've done that already. So we have to preserve that evidence in order to protect the practice.
fascinating. I had no idea.
Yeah.
That's
Yeah.
very interesting.
And I understand the desire to just get back to work. Just make it fixed. Make it
Mm.
automatically, bippity boppity boo, wave your chicken
Right.
bones over it and whatever you got to do to magically fix it.
Yep.
But no, you got to stop. You have to go through a process, identify what was accessed, patient information was accessed or exfiltrated out of the office. Um, yeah, there's a whole list of things that need to be done.
Mm.
And if you start deleting that information before a professional comes in and looks at it, you might be having to pay for everything out of pocket.
Oh, man.
And that can get very expensive.
Yes, we need to let people know. You need to, yes, this is something we need to get the word out there, Amy,
We're
because
working on it.
yeah, did not know that. That's fascinating.
Yeah, definitely a thing. I could do a whole talk on just cyber insurance and how it's
You
changed over the years.
should.
I know way more about cyber insurance than I probably should.
Well, you should because I only recently learned about it. I mean, just, right before you, but
Didn't
yeah,
know
I
it
didn't
was a
even know there
thing.
was a thing. Yeah.
So when I was doing IT, I want to say 2013, 2012, 2013, somewhere around there, there was the omnibus final rule with HIPAA, and it
Mhm.
took the privacy rule and the security rule and kind of mushed them together and made business associates, IT providers like we were, responsible for things
Right.
and financially tied at the hip. And so we took that very seriously. And at the time, we were in a group with a bunch of other dental specific IT providers, and there was an insurance guy there that asked who here has errors and omissions insurance. And it was us and one other group that raised their hands. And these were
Wow.
big players in the industry. And
Right.
I was like, we're the smallest people here. This is ridiculous. How are we better prepared and better equipped to handle something like that?
Right.
So it kind of highlights that you even have to ask your IT providers vendor vetting questions to make sure that they're doing everything they need to protect you.
That's right. We put our trust in a lot of these different facets that we use in our dental practices. We put trust in these vendors, we put trust in this equipment, we put trust in our staff members, but it really is worth asking a lot of questions. You
Oh,
know, that's that's your reputation, that's your license, that's your business, that's your livelihood
yeah. And your future.
and your future.
I have
Yeah.
another unpopular opinion.
Okay.
So, unpopular opinion, just because a vendor says they're HIPAA compliant doesn't necessarily mean that they actually are.
But what if they have a HIPAA compliant certificate on their website?
That's adorable.
I know the answer to this.
Yeah, we've talked about it a lot. So that's not recognized anywhere. That's just a marketing gimmick. I mean,
Wow.
I
There's
could give
there's
you a
no
gold,
HIPAA certificate?
no, I could give you a gold sticky star. In fact, I used to, just because people like gold sticky stars.
Wait, is that kind of like a lot of these little organizations that are coming out and creating their own little certifications and calling them like a certification, like an industry certification? Like, yeah.
Yeah, there's certain places like I hold certifications in what I do, but they're from huge sources that they actually certify and have processes for certification within certain industries. And
Hmm.
these are like the big players in that space.
Right.
So, I mean, like I could go and say, take this class and you'll be certified in this. You're just taking a class.
Right.
That's entirely different. Like that's not years and years of experience and education and justification for what you're doing,
Hmm.
and like a deep understanding.
Right.
That's what true certification is. But yeah, we see this. We see a lot of times people just put these little icons and pictures and badges and things like that on their website and their email, and it's a marketing gimmick.
It is.
Not to say anything disparaging about other companies, but it's not recognized by any government agency
Mm,
in this space. It's not a thing.
not a thing.
Yeah.
Okay. I've got an unpopular opinion.
Yeah.
The doctor's son or daughter or family member or the office manager's family member, high school student can come in and work in the summer as a sterilization tech in the
With no
office.
training.
Wah, wah. Nope. Any person that has a likelihood of occupational exposure to bloodborne pathogens, this is a federal standard, must be trained in OSHA's bloodborne pathogens. Has to be. So if you pull someone off the street, you've got your aunt or uncle that lost a job and you want to put them in as a sterilization tech, they need to be trained properly. They need to know what's going on. They need to know how to use the equipment. They need to understand IFUs. They need to understand the process of sterilization, instrument cleaning, disinfectants, so on and so forth. I could make a huge long list. But just sticking your kid in sterilization to help out for the summer,
Yeah.
that's a big no-no without any training.
I'm in
Big
here
no-no.
clean. Oof.
Yep. Yep.
Now,
Nope.
what about interns? Same thing, right? They should be trained too.
Yes, absolutely. Interns should be trained. In fact, I went to an office yesterday that I had never practiced at, and they had me sign their emergency action plan and their radiation plan policies.
Wow.
So I knew when I started working at that office yesterday what to do in case of an emergency, what their standards and policies were regarding x-rays and their equipment and the treatment of their patients. Now, I've only done something similar like that in one other office. Now, I will say, and I'm going to go off on a tangent on temporary employees, but usually the temporary agency is in charge of providing that training to that licensed professional. And so when you go into these offices, you have the training already, but not necessarily on their office policies. It's not a bad idea to have your temporary employees sign something, even if they're there for one day. Show
Yep.
them around, show them the fire extinguishers. Where's the AED located? Don't just show them how to log onto the computer and get their patients back. There's a lot more to working in that practice, even if it's just for one day. So, same thing with interns. If you have someone coming in and watching over your shoulder for the day or doing some small procedures or whatever the case may be, they need to be signing some documentation saying that they're going to be exposed to A, B, C, D, E, F, G. Same thing with HIPAA. If they're going to be, being able to view patients' charts, they need to be signing some sort of documentation for confidentiality.
Yeah, absolutely. And
Yeah.
we make it easy. Yeah.
Yeah.
We make that super easy. We do like a high level checklist type training for those people in less than 15 minutes. Everybody can spare 15 minutes just to cover all your bases and
Hmm.
protect your assets.
Yep.
Yeah.
Absolutely. Absolutely.
So, unpopular opinion, encrypted email absolutely needs to be done. Encrypted at rest in your inbox and encrypted in transit when you send it to someone else.
Okay.
And just because another practice complains that they don't want to put in a password for your encrypted email does not mean that you get to break the law because of them.
There you go. So what do you do in that situation? What do you recommend if the other office is complaining? Don't send them anything or
Send
have
it
them
to snail
figure.
mail,
There you go.
or you can have the patient come and pick it up and take it there. But eh, so many places, so many businesses now in and out of healthcare are requiring confidential logins and passwords to be created for just about everything.
Yeah.
And this has been required since, 2009, 2010, maybe even
Mm.
before.
Right.
And, we were early adopters of that. It's not hard, it's not expensive.
Hmm.
It's I still see people that don't have it, or they say, well, I clicked the encrypt box in Outlook, or I got a business associate agreement with Google for my Gmail.
I know that's not true.
We've had
I
that
know that
conversation.
one. I know that one. Oh my God.
Sadly, I know. I wish I could say yes to everything and everyone, but that's why I get called a fun hater sometimes.
Yeah, man.
And
Wow.
it's okay. It's fine. We're fine.
I'm fine. You're fine. We're all fine.
It's totally fine.
Thank you for joining us. For more information, please go to www.copperpennyconsulting.com. Bye.